Welcome back to the Healing Motherhood Podcast. In this episode, we're going to talk about the 4 themes of birth trauma as described by Dr. Cheryl Beck in her study that was published in 2004. This study looks at various experiences from different mothers who experienced traumatic childbirths. So today we're going to do just a quick overview, and then I hope that you'll hit subscribe to dive a little bit deeper into each of the 4 themes in the coming days. These themes shed light on the emotional and psychological impact of childbirth, emphasizing the need for compassionate, patient-centered, trauma-informed care. So the first one that Dr. Beck discusses is to care for me. Was that too much to ask? This talks a little bit about not feeling cared for or cared about by professionals, by the healthcare providers that surrounded the person, right? An example of this could be feeling like a number in somebody's clinic, right? The next theme is to communicate with me. Why was this neglected? This one is a big one because oftentimes during birth, especially when we talk about surgical birth, which is interesting, you will find that the person giving birth is not really in on the process, right? The doctor is talking to the nurse about either what they're seeing or about their weekend even, or dinner plans. These are not uncommon things that we hear in the stories from mothers, which is super sad. The other part of this is communicating what's happening, right? So a good example of this is with my first, I had an emergency cesarean. And, on our way in, I literally thought that I was going to die, right? There was no communication in there that said, hey, everything's going to be okay. You're going to be okay, and your baby's going to be okay. We just have to get him out quickly, right? And so it can be as small as that, right? So that's one theme, is communicate with me what's happening. The next one is to provide safe care. You betrayed my trust and I felt powerless, right? An example of this is when there is a lack of informed consent, where there is this kind of telling people what's going to happen instead of asking their permission, okay? It is when a doctor does something without explaining what they're going to do or asking permission first. And when you think about the way that things are in labor and birth, that can be really a huge violation. And then the next one is the end justifies the means. At whose expense and at what price? So this is a little bit leaning towards what we talked about in yesterday's episode of the whole all that matters is a healthy baby, right? And it's saying, okay, well, at what expense? At a birth injury for mom, birth trauma for mom, feeling violated, having an injury, not feeling good about the birth experience, right? Feeling upset with what happened, having felt powerless, right? Those are all things that impact the mom. And so it's like, okay, yeah, the ends justify the means. Well, your feelings still matter, right? But in this case, it does not feel like they do. And that's kind of what that theme is getting at. So just to give you a little bit of an overview before we dive more deeply into each of these themes, before we talk about examples of each theme, I just wanted you to have the background knowledge before we dive in this week. So go ahead and hit subscribe. You can follow along as we dive into each of these themes. And if you are noticing any of these themes from your birth experience, drop a comment. Let me know which one was most prevalent in your birth experience. If you're a doula, which one have you witnessed the most? And then there is also a free resource below. If this brought up any big feelings for you, please use that resource. It will help you to just drop your shoulders and take a deep breath and feel a little bit safer after that trigger.